Stop recording. I'm hoping that you guys are doing your reading. And so we're focusing here on that. So I want you to look about the collaboration. Who are we going to be collaborating with and why is that important? Okay, I'm gonna leave you guys for a minute. Alrighty, we are working this. Martha, you need your camera on. Amodi, you need your camera on. It is going to
Oh,
populate
my
on
camera's
Zoom.
on.
Yeah, it was just off.
I
Modi,
was
yours keeps going on and off.
I
I
was
don't know
looking
why.
at the book.
Okay, so make sure you keep your cameras on and try to look at the book as well. So if you need to log on Zoom on your phone, you can do that to make sure your cameras are on because it alerts Zoom when your cameras are off. All right, so what kind of information are you guys coming up with here? You are group one, so you're working on slide number 1. What can you tell me about your group? You guys are doing pros and cons of rural nursing. What are some things that you guys came up with?
Well, I'm trying to access the book. It won't let me access it. So
Okay, but you should have done your reading right for tonight, so remind yourself what you read, okay?
yeah.
Some cons, like the rural nurse is supposed to might be expected to know and everything about everything. Some language barrier, maybe some like technology deficits. As far as that goes with the rural community.
Okay, and what do we know about rural
Yeah.
communities? Does everybody know everybody or no?
Yeah,
Yes.
one of the cons is that the nurse gets to know more closely the patients that she has under her scope. So I think the relationship between patient and nurse is better than like a nurse for a big hospital or a big city. So the communication, I think, is better for the nurse and the patient.
Okay, so there's
between
a
them.
tight relationship. Very good, Amodi. There's a tight relationship there, and that's something. What is the con of that, though? How could that be a negative thing? Not the relationship per se, but the closeness of the community.
That you're expected to do a lot more because you know the nurse or you know the situation, and it might put more pressure on care for that person, and they might not meet that expectation.
Okay. What's something in your book that it talks about is a negative thing that everybody knows everybody?
I think one of the negative things that the nurse can find is more elderly population in the rural areas. So the elderly population is, I think, it's bigger than in a city, and
Are
maybe
you
they
going to have as many
the
people in a rural community that you will have in an urban community?
no, of course not.
So you
It's
can't really say that you're going to have more older people there because what ends up happening in rural communities is oftentimes they don't leave. So you even have young people there. But what's a negative thing about knowing everybody? What might be hard for the patient then?
Could it be like opening up about what they're going through?
Keep going.
Because
Opening up. Why would
they're
they not
afraid
want?
that
What
it
kinds of
might get.
things are they not going to admit to?
Mm,
If everybody knows
maybe any.
everything, go ahead, Yesenia.
Yeah, anything that's maybe going on at home or personal stuff that they don't wanna, that you would normally talk to a doctor that you don't really, or a doctor or a nurse or something like that, that you don't really talk to them like that, like in a more comfortable way. They wouldn't want to share that because they're afraid it might get out there or something.
Good. You're beating around the bush a little bit. What things specifically? Think about what things people don't like to admit to. It was in your reading last week,
the-
these kind of things.
Could be like alcohol abuse, drug abuse,
Addiction.
sexual,
Absolutely. Abuse of any kind, right? People don't usually want to talk about that or admit that. What else is not something that you know is something you know that people don't like to talk about either? It's kind of has a bad taboo on it. We're working as a society to not make it so, but what kind of illness do people not like to admit to? You're being very
Depression?
specific. Be a little more general. Depression's a type of
mental health
there you
condition.
go. You hit it. Yep. Mental illness, right? Mental illness. Nobody wants to talk about that. Nobody wants to admit that. You're certainly not going to see that admitted in a rural community much. Abuse is another one they're going to hide from telling. So you have to be really careful about how you're assessing in that area. What other kinds of things can you think about? What are you going to see more of in a rural community related to illness?
Their exposure to like the farmers, their exposure to chemicals or
Right, the pesticides. Are we going
the
to see more acute
pesticides. Yeah,
illness or
they
are we
are
going to see more chronic illness?
more chronic illness.
Why? You're right. Why would you see more chronic?
Because people are not they don't move to the city to like to see a doctor very often. So when they go to a doctor or when they have access to medical services, it's kind of when they have already developed a condition like obesity or smoking for years, and they already developed diseases related to those bad habits. That's what I think.
Yeah, that's right. So you're going to see that. So what are some things specifically that you guys will have concerns with regarding women and children? What do we know about infant mortality in a rural area?
Well, regarding infants and children, going back to the same thing, the sexual assault, they're less likely to report that.
Well, kids
Infant
usually
mortality
report.
is going to be
Kids will report. Kids are, if young kids, they tend to not know that abuse is not something that everyone does, so you're not going to see that so much. But what will you see with infant mortality?
it's going to be higher due to the amount of education maybe that the parents have, and they're not visiting the doctors as often.
Good. You're not going to be going to that doctor's appointment every week or every 2 weeks or every month like you would in an urban facility. Okay. So you guys keep working on that. I'm going to come back. We'll come back in a little bit. And I'm going to leave your breakout room. Okay, how are we doing here?
Recording in progress.
What's up?
How are we doing?
Good.
You guys are room number, what room are you? Let me see. 5. So let's take a look at what we're looking at for group number 5. We're looking at parish nursing and qualities that you need. What are some qualities that you guys talked about?
Having a good sense of like education with decision making for patients and a lot of like a broad
Understanding.
spectrum of different, what was it? Practices and spirituality.
Okay, what do you need as the nurse yourself?
Like good communication skills.
Yeah.
Like really
That's
strong
true in any
communication
nursing.
skills.
That's true in any nursing, but specific to parish nursing.
Oh, I saw that. You have to have, where is it at?
Personal spirituality.
It
Yeah, and
says
awareness,
parish
uh-huh.
nursing. You have to have a are you talking about the degree, the baccalaureate degree?
No, because that doesn't really matter. I know it says that in the slides, but what you really need is a strong sense of your own faith, right? Because if you're going to be
Yeah.
working with spirituality and healing, and if you don't have a sense of faith, now you don't have to have the same faith as them, of course, but if you don't have that strong sense of faith and understanding, what is that going to do for you and the patient?
You're not going to have good communication with them because you're not going to be able to understand
What
how
they're,
they feel.
yeah.
Yeah, you're gonna have a hard time, right?
Or be
Understanding
able-
where their spiritual health plays a
Yeah.
part. And so the big thing about nursing, and not just with parish nurses, is that it's the whole being, right? You guys have been taught that since you
Mhm.
started nursing. So it's not just about them physically. What other kind of things are we looking at with parish nursing? What other kinds of concerns do we have?
Do you mean like well, I read that they have a lot of education with end of life care and those types of decisions.
Hmm,
Do you mean
you read that in parish nursing, or you read that in
patient?
hospice nursing?
It was in parish nursing. I said
Yeah, that's not
critical.
something I would focus on. I mean, that's fine, but you need to know the whole spectrum of life as a parish nurse, because if you're dealing with a community, right, you're gonna have kids all the way up to geriatrics. Right, so that's not something that you
Yeah.
would necessarily focus on. Something you should know as a nurse as a whole, but. What are some things that you think are important to become a parish nurse?
Having a good sense of the community or your population.
That's true with any nurse,
Or
right?
understanding of faith. Yeah.
What else?
Practicing faith and spirituality.
Right, yeah, we said
Their
that,
mental
faith and spirituality, what else? What other kinds of things are we looking at with parish nursing? Not, you are looking at spirituality, but what else are you looking at? Their physical health, their spirituality, what else?
not their mental health or
Yes, their mental
anything
health.
Holistic.
Yep. Their mental health, of course. You're
Mhm.
looking at them as a whole being, right? And how does that mental health play with their spirituality? And what do they get out of that? What other kinds of things? Let me see what else you guys, you had another question on there about how would you use your med surge experience or mother baby? And I went in some scenarios. How would you use that as a parish nurse?
I think you have to have the strong sense of education with both med-surg and mother baby because mother baby nurses teach a lot with new babies, new moms, and like referrals and helping them like maybe breastfeeding or with med-surg
So
patients
how
on
would
their
a parish nurse fit
medication.
in there? How would a parish nurse fit into that scenario?
Wouldn't they want to encourage them to keep applying their faith, by prayer, using their mantras, stuff like that, like still encouraging like their spirituality, even though they're going through like all this, like so they don't lose that, like to kind
Parish
of put it
nurses
to help
aren't
put it
gonna,
together.
they're not pastors, so they're not gonna or ministers or priests or anything, right? They're nurses. So they're not going to be telling people to pray, right? They're not going to be guiding them that way because the people have their own faith. If you're working with a congregation or if you're working with an institutional based parish nursing, those two different types. Give me a specific scenario where you can use mother baby skills. What's a scenario? You guys know what a scenario is? An example.
Would it be like, this sounds morbid, but if they lost the baby, to their faith and sexuality, to help them in that process?
I guess, yeah, that's one way. That is kind of morbid, but let's think about a healthy baby.
Let's see.
April, what do you think? Asada, you're
Would
not
it
saying
be
anything either.
like, would it be like, so you baby and like different religions and spiritualities have different practices, so you could like advocate for that baby and that mom in whatever like spirituality that they have?
So
That they
tell me,
follow?
I'm confused. Tell me a little bit more. Asada, you can put it in the chat if you want,
So-
whatever you're trying to say. I don't know why we can't hear you. Where are you going to see that with?
So like if a mom was like strictly only breastfeeding their child, you could advocate for them, like if they're having issues, like help get a lactation nurse in there and stuff like that.
Good. Yeah, that's a perfect scenario. So a parish nurse can do anything with a mother baby, right? Just like a nurse in a hospital can do something with mother baby. So you're going to do the breastfeeding, you're going to be doing infant care, you're going to make sure that the mom is eating enough, right? Because you have to eat more when you're breastfeeding, those kind of things, right? So all those are examples, very good examples. Think about med surg. How about a diabetic patient? How could a parish nurse help with that? Helping a single
Getting
mom who
them
may not have a
resources
birth
that are
partner
out.
with her. Hold on, I'm just reading the chat here. Single
Okay.
mom without a partner. Definitely you can have emotional support there, right? That's always the case as a nurse. And think about a diabetic. What are you going to do as a parish nurse for a diabetic?
Education and help them find resources that are close to them if they don't have the means for things.
Yeah, like support groups.
Yeah, like a support group.
Healthy eating.
Yeah, all that stuff that you would normally teach as a nurse, right? Just because you're a parish nurse and you're looking at spirituality, that's their emphasis is that they can focus on the whole being, right? And focus on all pieces of the person. So some things to think about. Okay, I'm gonna come back. Oh, I won't come back to you guys, but we'll end in a little bit and come back as a group, okay? So just make sure you guys are ready to chat about it when we come back.
Okay.
All
I
right,
heard that.
here.
Hello.
Hi, how do we do? You guys
I
did
think we're doing
migrant
pretty
workers,
good.
right?
Mm-hmm.
Migrant workers. What kind of things are they exposed to?
Infectious disease, pesticides, herbicides,
Mm-hmm.
homelessness.
Dance with the Queen.
I wouldn't focus on homelessness necessarily, but what's another big problem? A big problem that they
Yeah,
come
we don't put
across?
that in there.
Chronic disease like diabetes, stuff like that.
Yeah,
Language
but
barrier.
that's not a focus. There's something else that happens to migrant workers. Think about what they do all day long. What body
Well,
system is
cancer?
going to be impacted?
Their skin. Wouldn't it be cancer?
Well, skin is one, but
Cancer, yeah.
there's another one that's pretty major. What's the other one? Think about what they're doing. They're bending down all the time. They're leaning over,
back?
picking
Their
crop.
back, yeah.
Oh, their
So what
kidneys.
system? What system are we thinking of?
Neuromusculoskeletal.
Yeah, you got it, Julie.
No?
And so you're
Oh,
gonna
that's right.
have, yeah, you're right. It's exactly, they're bent over. They're like, so they're gonna complain of back pain a lot, right? Because
Okay.
they're bent over all the time. What's the
Mhm.
type of back pain you get when you have it traveling down one leg?
I wrote it in my notes somewhere, I feel like.
Starts with an S.
I'm trying to flip back and forth. Sciatica?
Sciatica, good, very good. Sciatic
Yeah.
nerve, so that's what you're gonna be worrying about that for them too, right? Because it's gonna be aggravated by certain movements and motions, so we're gonna be focusing on that. We're gonna be focusing on skin because they're outside all the time, and our pesticides is our big one, right? What kinds of prevention are we gonna do for pesticides?
Maybe proper using your PPE or yeah.
Okay, what are we gonna
The
do
protective
before
equipment.
we do PPE?
Teaching
Teaching to who?
to
So would it be both the farm and the workers? Or both the?
Tell
I
me
guess
what you're gonna
where they're
teach to the
employer and
farmers. You're on the right page. You guys
What
are doing
signs
well.
and symptoms to look for?
No, because the farmers aren't looking for signs and symptoms. They're not medical professionals, right? What are we gonna teach them about? Before anything happens to their migrant workers? You're close with
Signs and
signs and symptoms,
symptoms?
but no, we're not gonna teach them signs and symptoms necessarily, but what are we gonna teach them? We're gonna teach them that pesticides aren't good, aren't we? So that they know they're not good, because farmers may not, we don't know if they know or care, right? So that's gonna be a primary prevention strategy, right? That we're gonna be doing is we're gonna teaching our farmers about the effects of,
Immunizations also, because
what'd you say? Owen?
migrant worker has a
Immunizations.
immunizations.
Oh, immunizations, yeah, for sure.
Immunization.
Yeah, that's not really, I mean, yes, that's always important, but when we're looking at migrant workers particularly, we're being very specific on what we're looking for with them, okay? And so immunizations are always good. You're always gonna teach them about immunizations, every group we talk about, because you always want to do that. But we're emphasizing on migrant workers, particularly our pesticides, our skin, our musculoskeletal, right? We're gonna do hand washing stations, right? Because how do you think pesticides are passed?
Through touch and
So
inhalation?
pesticides, if anybody's ever seen it, they come overhead in an airplane and they just sprinkle it all out, right? So if you get it on your hands, you want those hand washing stations for the people who are exposed. What's a tertiary prevention we're gonna do?
So when they, like, if they're already diagnosed with a disease, like, I guess offering education to that specific disease, like what they need to do.
I'd stay a little bit away from education because you have to explain the whole scenario. You know what I mean? You're like, well, if they were exposed,
Okay.
what's
Yeah.
something we would definitely do? Because you know, at tertiary, what does that tell us?
They already have.
Mental health council.
To
Medication, no?
not let it get worse.
Yeah, medication, treatment, right? We're gonna do those kind of things with our migrant workers.
Health counseling.
Yeah, health counseling for sure. Good. All right, you guys did well on that. We're gonna come together. You're gonna share what you found, okay? I just have one more room to check in with and then we'll come back together. And that was 4.
Okay.
They do alcohol.
And
Oh, here we go. I found some bullet points.
Okay, you guys don't have your cameras on. Nobody has their
Substance
camera on,
abuse.
so make sure they're on. Yeah, there you go. And maybe it was just delayed on my end. Tell me, what have you guys been working on? What's your topic? You're 4, right? So let's look at group 4.
Yes.
Yeah,
So, first
unfortunately,
off,
we
accidentally we're working on the wrong one at first, but we're on the right one now.
yeah. So
All
group,
right.
group 1 got all of our answers first.
All right. What do we know about Medicaid and Medicare? What are they?
their insurance plans that the government pays for.
Okay, one is going to be state run and one's going to be federally, they're both federally funded, but one's going to be run by the state. Do you guys know which one that is?
Medicaid?
Mm-hmm. And the way to remember Medicaid is that every state has a different name for Medicaid. So in the state of Colorado, it's called CHP for kids. Jenny, where are you?
Florida,
Florida. What's it called in Florida?
Medicaid.
No, it has a fancy name.
Oh, you
It's like
mean
some-
the Florida Kids Care.
Yeah, there you go. That's what I meant. Good. Anna, where are you?
Florida.
Oh, that's easy. Michelle, you're not in Florida.
No, I'm in Ohio.
I knew that. So tell me, what is Ohio called? Do you know?
Like the specific company they use. I think it's like
No.
CareSource.
No, it would have a name like Kids Care, or they always make it sound pretty, nice for the kids. So think about what that's called. I don't know in Ohio what it's called, but just a way for you guys to remember that. The definite thing to remember too is Medicaid has the word aid right in it. Medicare has the word care right in it. So when we're looking at aid, who do you think is going to be getting that aid?
Low income.
Yep. Who else?
I'm sorry, you were cutting out on.
Anna's saying something, but I can't hear her.
Yeah,
boy.
she's cutting off.
She's been cutting off. Okay, so what were we saying? Medicaid, so you're gonna give aid to low income, and then we have our Medicare. Who's gonna need care? When you get older, you need care, right? And so we'll have our 65 and over.
Is my
And
speaker on in there, babe?
we heard you. Your speaker on something. So think about those are federally or state funded. What else did you guys find out about? Who reimburses? Who gets reimbursed?
Let's see.
It's very specific
Says
what's gonna get
Medicare.
reimbursed.
Well, Medicare, it reimburses hospitals and the physicians.
Give me a little more detail. What kind of services are gonna be covered with Medicare?
It depends. There's different coverage.
No.
There's like
I mean, there is different
Part A or
coverage.
Part B.
Yeah, but that's just different. Those are just different titles. They're all gonna cover this different, they're all gonna cover the same kind of things. What thing is Medicare always gonna cover and will not cover something else?
Inpatient hospital stays?
Medicare sometimes doesn't cover all that.
Okay.
One thing to think about with Medicare is sometimes people need a backup. So we're gonna do primary prevention with our 40 and 50-year-olds, knowing they need a secondary insurance. But regardless, Medicare will not cover ADL activities. They're gonna cover only skilled nursing actions in the home. So something to think about when you're looking at that, okay? Medicaid, sometimes people will go from Medicare to Medicaid based on their income, and if something is not being covered, they will then switch their coverage. So if they're retired and they don't have an income enough, or Medicare is not covering something, they can get Medicaid too. So some things to think about with that. And what was the last question you guys were
Well,
gonna-
do they also cover all medications, right? Like,
Not necessarily. You have to be careful with saying all, because there's always an exception to all. Do you know what I mean? So you're gonna have some medications may be covered, some may not. Some may be covered at 80%, some may be covered at 100%, some are covered at 50%. Some of the medications that they don't think are warranted, they're not gonna cover it. So, you have to be careful with what's covered and what's not. And these are older people, sometimes they're on limited incomes. So important to think about when you're dealing with this population. All right, you guys are going to present. We're going to come back together right now. So I'm going to leave you guys and we'll see you in a minute.